In the US, only 25% of change management projects stick. 25%. Now imagine what that number is when working across cultures and languages. Partner effectively, you need to check your assumptions at the door. Understand what your partners value and believe. What do your partners really want? What don't they want? What is important to change? And what is important for them to preserve? In China, Sanford World Clinic entered into a partnership where those concepts were vital. Kunming, which you heard about a little bit ago, has a population of over 7 million people. It's known as the City of Eternal Spring. It's in the Yunnan province in southwest China. Yunnan is the most ethnically diverse province in China. In 2013, Sanford World Clinic partnered with a Chinese healthcare entity to consult, mentor, and manage day-to-day operations in a pediatric outpatient clinic at CalMet International Hospital. We placed a Sanford Western-trained physician and a clinic director to work alongside and mentor the Chinese physicians and staff. We agreed on 3 main priorities. 1, to integrate sick and well care into a primary care model, to increase efficiency, improve patient safety, and the patient experience, to transition from experience-based care to evidence-based care. Once we opened, we observed children coming in with simple rhinorrhea, simple runny noses. They would receive IV fluids, antibiotics, antivirals, steroids, traditional Chinese medicine, and sometimes interferon. The Chinese physicians were prescribing unnecessary and unsafe medications. Changing this practice really became our focus. We tried the obvious. We shared guidelines that were evidence-based. We educated administration, physicians, patients, and staff. It didn't work. We had small successes. We had a few physicians that embraced the concept, but it just wasn't quite the right fix. So we went back to our partners. We validated our assumptions, and we reaffirmed that our goals were aligned. We understood in China that it is a society where positional authority is respected, relationships are key, and preserving honor is vital. We knew with the one-child policy that parents and grandparents, that one child to them is prized and priceless. They worry about the child's health and readily seek medical care for minor ailments. The health care there is fragmented and expensive. Well care, acute care, and specialty care are all provided by different physicians in different departments in different facilities. So it's really difficult to establish a trusting relationship with a physician. Grandparents relied on traditional Chinese medicine, where parents increasingly wanted Western-based medicine. All of this in a society that values harmony and honor. So we dug deeper, and we learned that Chinese physicians are incentivized for prescribing drugs and tests. Money came from the hospital and the pharmaceutical industry. Practically speaking, they could double their income by prescribing more. They had an ethical conundrum. By following evidence-based care and not prescribing medicines, their ability to provide for their family was at risk. So we went back to our stakeholders. We discussed strategies to minimize the financial impact of not prescribing. At the same time, unbeknownst to us, the Chinese central government was cracking down on kickbacks. The timing was perfect. We wrote clinical practice guidelines that fit to the China environment. We educated the leaders, the physicians, staff, and families, again, on evidence-based medicine. We implemented the guidelines, and we monitored progress through chart audits and observation. We created a physician dashboard and started to provide feedback. Meetings were set up with leadership and with individual physicians. We celebrated the wins. We continued the monitoring and providing feedback. We encouraged compliance when it was needed, and we continued to educate. How did they do? I'm really proud to say that our Chinese partners and the physicians did the right thing. We were able to decrease the amount of medications prescribed at a visit from an average of 4.5 meds at a visit down to less than 1 medication per visit. With antivirals, we got that down 17%. Pediatric care is safer and more cost-effective for the families. We still need to monitor, educate, and provide feedback and continue with operational strategies there. In summary, I love the concept of the iceberg. What you can see clearly isn't the total picture. Be curious, ask questions, listen. The fix isn't always obvious. Look for and consider the subtle, the formal and the informal, the overt and the covert. Consider that concepts don't always translate. Remember that every group, whether it's a family, whether it's an organization or a country, has its own culture with distinct norms, beliefs, and values. To partner effectively and sustain change, meet people where they are at, and appreciate their reality. From there, you can create trust, shared assumptions, values, and goals to proceed from. And remember to enjoy the journey along the way.